Carlotti Center, and I am here with Dr. Albert Carlotti answering some of the most common questions in regards to facelifts.
Great, let's do it.
All right. Dr. Carlotti, can you tell me if you were specifically trained in the field of cosmetic surgery, and if so, for how long?
I was. My residency as a maxillofacial surgeon encompassed many things: cosmetic surgery, reconstructive surgery, cancer reconstructive surgery, functional rehabilitation surgery. But we did do a fair amount of cosmetic surgery as part of our training. I then, following my residency, decided to spend an additional year solely dedicated towards cosmetic surgery of the face and body in a fellowship associated with the UT Southwestern Medical School in Dallas.
Can you tell me what would make a person a good candidate for a facelift?
You know, the thing about facial aging is usually patients will describe a point in their life where they just don't look like their younger self. They'll describe a point in time where they were, over a very short period of time, things changed. That's where a patient seems to be best motivated to want to do something about it. Patients have to be healthy, they should be non-smokers, they should be willing to spend the time and the money necessary to make those changes, but really it's a willingness to want to do something for themselves. It's not about vanity, it's about wanting to look and feel on the outside the way you do on the inside.
As a patient, what is something that the patient can do to achieve the best possible results?
Well, first is have a consultation. Come see us and learn about what it is about what you don't like about your face or body that you want to change. And importantly, in that consultation, we're going to give you information that will help guide you as to what the best procedure would be to select to help meet those goals. So identify the goals so that we can help meet those goals. The next thing I think is to have realistic expectations about what those outcomes may be. And that's something, again, we will spend time with you helping you make sure that you're going to meet the expectations that we can deliver upon.
Where and how do you perform the facelift procedures?
Well, I'm privileged to do facelifts at the hospital, but we really don't take patients to the hospital to do this for procedure for good reason. With all due respect to my colleagues that operate at the hospitals, hospitals are full of sick people. We try not to take otherwise healthy patients and bring them into an environment where they could be exposed to pathogens, etc. We do the procedures here in our private surgical center. Patients appreciate the privacy, they appreciate the concierge, Four Seasons-like atmosphere, so that they know we're their only patient. They feel that sense of comfort, knowing that everybody here in our staff and our surgical center are here just to take care of them. There are no distractions, there are no other patients. So the private surgical center has given us the advantage over the years of never having had one surgical infection at all. That's a statistic we're very proud of. And the advantage too is we start on time, we finish on time, and patients seem to like that as well.
Dr. Carlotti, can you tell me specifically about the 4D facelift that you perform?
Absolutely. The four-dimensional facelift, or the 4D facelift, focuses on working from the skeleton to skin, working from the inside out. We've learned that components of aging have a lot to do with changes in the face from the skeleton to the skin. Believe it or not, skeletal bone does atrophy or shrink away as you get older. Some patients aren't born with certain attributes that they want to change. Maybe they don't have a strong jawline or a good chin, maybe weakened cheekbones. All of those really do support the soft tissues, so we start there first. The next layer up is really the muscular layer. The muscular layer of the face, by the forces of gravity, move forward and down. A good facelift really repositions those muscles back to where they used to be. It's almost a reconstruction of youth. The bad facelift, that's the 4G facelift, where they look like they jump out of an airplane, puts things back in the wrong spot. We don't do that. That's where patients have that stigmata of being operated. We want you to look like you younger, not you operated. The next layer up of the face is really the collagen layer of skin. Think of it as the scaffolding of skin. It supports your skin's structures. as we age, collagen loses tone. It's like in a rubber band or a spring losing its ability to go back to where it used to be. Even a tube sock. Once you wash it too many times, it's just not going back. The problem is if you pull tightly on skin and the skin has lost its tone, the skin will relax in a very short period of time following surgery. And we call that relapse. Patients call it a not very long result, short-term result. So the components of dealing with that is very critical. We do that with a laser. And the last is really dealing with the skin itself. Aging, sun exposure, genetics, maybe smoking history, those types of things affect the way our skin looks. And you want the icing on the cake to be the best part. So really affecting the skin, uses of lasers, other types of non-surgical treatments that we do, helps really finalize the package. So in summary, the four-dimensional facelift is a natural appearing result because we respect the anatomy, what caused the aging, and really address it sequentially from the inside out.